Hi, I'm going to be doing a trauma assessment on a patient named Gonzo. So here I go. Okay, I'm at the scene. I have BSI. Sorry, my other gloves broke, so I don't have the real gloves on. So I would have BSI. I'm looking at the scene for safety. Is there traffic? Is the vehicle safe to even approach? Does it need to be stabilized before I can get in the vehicle? At this point, I'm looking to see Gonzo's actually been thrown from the vehicle or some sort of scenario where he's actually attainable and on the road and it is safe around me. So I'm going to go ahead and have a look at him. I'm going to approach him. I'm going to just say, hello, hello, checking his AVPU at that time. Is he responding to my voice? Is he looking at me? Is he responding to verbal? Is he alert? Is he responding to painful stimuli such as a sternum rub or a little pinch? And at that point, if he would seem to be having a stroke, I would use the Glasgow Coma scale. I'm going to be checking his airway first thing, doing a head tilt, chin lift, opening that airway up. I'm going to be placing my ear down so I can hear and holding my hand on his chest. Can I feel the chest rise? And can I hear him breathing? So he does have breathing at this time. I want to check his circulation next. Is there bleeding I can see straight away? If so, I want to stop and control that bleeding. What's the pulse doing? What's the rate and strength? Is it weak? Decision time, is he able to load and go? Is he straight away? Can I stop and do a better baseline vitals on him or get baseline vitals and do a secondary assessment? And at this point, we're going to say that there is time to do a secondary assessment on him. And so what I'm going to do is get the baseline vitals, and I'm going to start with his finger, and I'm going to poke his finger and get a glucose check on him. What's his blood sugar? I'm going to do a pulse ox, checking the oxygen levels in his system. I am going to do a radial pulse. What's that like? Is it weak? Is it strong? If I can't get a radial pulse on him, I am going to go to the carotid. I can do a brachial in the arm or do a femoral pulse if I have to, if I need to do that. So I am checking the skin condition. What's his skin like? Is it cold? Is it clammy? I'm going to do his blood pressure. What is his blood pressure? I'm going to listen to his lung sounds. I'm going to auscultate the lung sounds. What am I hearing? Are they bilateral? Are they good lung sounds? Then I'm going to go to AVPU. I am going to assess that again. Is he still able to respond? Is he responding worse? He can't respond now, or is he now awake and he's able to speak to me? So you're going to want to do that. You want to look at the eyes, check the pupils. That's going to tell you quite a bit about any brain injuries. Are they fixed, dilated, pinpoints? Are they equal, reactive? You're going to check the entital breathing in the nose. You're going to check the mouth for anything, broken teeth, blood, secretions that they could possibly choke on and need suction. You're going to then do an EKG, see what his heart is doing. And then you're going to, now at this point, you're going to do a head to toe assessment. And I'm going to start at his scalp. I'm going to check, see if he's got any lacerations. I'm going to feel it, palpate the head. Look at his ears. Is he bleeding from his ears at all? What about his eyes, his mouth, nose, his face? I want to feel around the orbital sockets, the jawline, the mandible. What does that feel like? I'm going to move gently down to the neck. I'm going to palpate the neck, looking at the position of the trachea. Is it midline? I'm going to palpate the jugular, and I'm going to feel the C-spine. What does that feel like? I'm moving down to the chest. I'm going to palpate the chest, feel the ribs. I'm going to auscultate lung sounds again. Are they still clear? I'm going to move to the abdominal area. I'm going to palpate the abdominal area. Is it soft? Is it rigid? Rigid could mean that he's possibly bleeding into the abdomen. You're going to assess the pelvic. You're going to push the sides of the pelvic. You're going to gently push down. If it's a male, you're going to want to just sweep, see if there's a privus in the male patient. I'm going to now do an assessment of the lower extremities. I'm going to palpate the legs all the way down. And I'm going to palpate the legs all the way down on this side. I'm going to ask them, can you feel me touching your feet? Can you wiggle your toes? Can you push against my hands? Good. And I'm going to do the upper extremities similar. I'm going to palpate them, checking my hands. Is there any bleeding? I'm going to ask them in their hands, can you feel me touching your hands? Can you wiggle your fingers? And can you grab my fingers? Now, I want to roll him gently on his side. I'm going to be palpating his spine, his posterior thorax, his lumbar, and his buttocks. Do I see any injuries or feel any abnormalities there? Gently rolling him back, maintaining his C-spine. I want to manage any secondary injuries and wounds at this time. Is there some bleeding? I can apply pressure, put a bandage and a dressing on that to stop that bleeding. I want to just apply pressure. And every 5 minutes, you want to reassess vitals in an unstable patient, and every 15 minutes for a stable patient. He would be seat-collared, backboarded, put on a gurney, and loaded to transport as soon as possible.